Did you know that genital herpes is a chronic infection? This means that once you contract the virus, it remains in your body for life, without a cure. In other words, you will carry it with you indefinitely, and from time to time it will appear, resulting in the noticeable symptoms of the illness, which include the presence of painful blisters or sores that can easily spread to others as they are highly contagious. If you want to learn more about this topic, what causes it and what the symptoms are, how it spreads, and what the medical treatment is, then stay tuned for the next video. It is estimated that genital herpes impacts around 491 million individuals globally, who are between the ages of 15 and 49. This means 30% of the population. An important fact is that a lot of individuals might possess it without even realizing it. I will elaborate on this later. But before, what causes genital herpes? Genital herpes is caused by two types of herpes simplex viruses: herpes simplex virus type 1 and herpes simplex virus type 2. While herpes simplex virus type 2 is the one most commonly found in the genital area and is a sexually transmitted infection, the herpes simplex virus type 1, which is more commonly found in the oral area and causes the famous cold sores, can also appear in the genital area due to oral sexual practices. But before you worry, I can guess many of you will say, "Pau! But how can that be if I had cold sores since I was a child and had never even kissed anyone?" Well, let's start by explaining what happens with cold sores. The herpes simplex virus type 1, which is most commonly found in the lip area and causes those famous cold sores, is transmitted through direct contact, that is, mouth to mouth when kissing, for example. That's why I always advise parents not to kiss their babies and kids on the lips, as this is a very easy way for you to transmit the microorganisms in your mouth to your children, and it's not right. Another way to contract or spread cold sores is, for example, in daycare centers, because small children share objects while playing, like utensils, straws, or things they put in their mouths and then share with friends who also put them in their mouths. These are some ways it spreads. Now you know. As for genital herpes, it is transmitted through sexual contact via direct contact with the skin surfaces in the genital area, as well as through contact with sores, blisters, or fluids from an infected person. Thus, as I mentioned before, in the genital area we can find both type 1 and type 2 because of various sexual practices. A key point is that herpes infections are very contagious, particularly if the person has symptoms, but transmission can also occur from one person to another, even if there are no symptoms and no visible sores or blisters, even when the skin looks normal. On the other hand, while it is less frequent and rarer, herpes can also be passed from mother to newborn during delivery, leading to neonatal herpes. Neonatal herpes is estimated to occur in 10 cases per 100,000 births worldwide. However, it is a severe condition that can cause permanent neurological disability or even death. The risk of neonatal herpes increases when the mother contracts the herpes simplex virus late in pregnancy. That is why it is so important for pregnant women to stay in touch with their gynecologist and maintain good care throughout their pregnancy, attending all their checkups. Now, let's discuss the next point. What symptoms does genital herpes cause? Well, I should tell you that in many cases, patients may be asymptomatic or show mild symptoms, so they don't notice they have it, but they can still pass it on to others. Symptoms may show up 2 to 12 days after being exposed to the virus, and some of them include the following. First, pain or a burning or tingling sensation in the genital area. Number 2, small bumps, blisters, or vesicles in the genital area, anus, buttocks, or mouth. Third, painful sores that develop when the blisters burst, ooze, or bleed. Number 4, the appearance of scabs, which form once the ulcers heal. Fifth, painful urination, which means pain or burning during urination. Sixth, discharge from the urethra, the opening through which urine leaves the body. It's important to note that the lesions can last from 1 to 3 weeks. Additionally, during the first outbreak, other symptoms can also be experienced, such as fever, headache, body pain, and swelling of the lymph nodes in the groin. After the first herpes outbreak, symptoms or lesions may come back after some time, which are usually shorter and less severe than the first episode. Now let's address the next question. Why is herpes incurable? Pay close attention. When a person is exposed to the virus, it can enter the body through any abrasion or microtears in the skin or mucous membranes. Once inside the skin, the virus can multiply in the cells, resulting in the characteristic herpes lesions as the body works to control the infection. But be aware that what follows is what keeps the virus from being eliminated. When the skin begins to heal, some of these viruses remain in the nerve endings called axons. The virus travels through the axons until it reaches nerve structures called ganglia. In oral infections, the virus gets to the trigeminal ganglion, and in genital infections, it reaches the sacral ganglion near the spinal cord. And in these places, the virus manages to evade the immune response and remain in a latent state, that is, inactive. It can remain this way for months or even years, and reactivate in response to different stimuli. This is what causes it to be a lifelong infection. Later, when triggering factors occur, such as stress, illness, fever, or flu, the use of certain meds or processes that weaken the immune system, the virus can reactivate in such a way that it travels back through the axons to the skin and causes a new outbreak. Reactivation and the frequency of symptoms can differ significantly from one person to another. A noteworthy detail is that before lesions show up, a prodromal period occurs, typically beginning 1 or 2 days before the lesions appear, meaning vesicles or blisters. In this period, the patient may feel symptoms like pain, tingling, or itching in the area before lesions show up. It's also crucial to mention that there are complications related to genital herpes that we should be aware of. For example, having sores in the genital area increases the risk of getting or passing on another sexually transmitted infection, like HIV, because a skin lesion represents an entry point for any other microorganism. Additionally, the herpes simplex virus can also spread to other parts of the body, for instance, to the fingers via a lesion or abrasion on the skin. This condition is referred to as herpetic whitlow. Additionally, the virus can also cause infections in the eyes, which is why it is very important not to constantly touch the lesions with your hands, as this may encourage the virus to spread to other body areas. And always remember to wash your hands. Another complication that can arise is during childbirth, as babies can become infected with the herpes simplex virus. Newborns with the herpes simplex virus are at risk of developing infections in internal organs, the nervous system, and even the risk of death. This is why I initially said that for pregnant women, it's crucial to have proper monitoring during their entire pregnancy, to attend their gynecological appointments, and to inform their doctor of any unusual symptoms they notice, and to undergo the tests and examinations their gynecologist recommends, in order to ensure the well-being of both the mother and the baby. In other situations, the herpes simplex virus can influence the nervous system, so if there is any suspicion, it is very important to seek medical consultation so the doctor can provide a timely diagnosis and proper. Let's continue to the diagnosis. The diagnosis of genital herpes is clinical, meaning the doctor can make it by observing the lesions, analyzing the symptoms you report, as well as your medical history. To confirm this diagnosis, the doctor may request additional laboratory tests. For instance, a sample can be taken from the lesion to determine if herpes simplex virus type 1 or 2 is present. Other tests can be done as well, such as blood tests that can determine whether or not herpes virus is present, and also check if there are other sexually transmitted infections. In fact, in previous videos, I have already mentioned the importance of getting these tests once you start your sexual life in order to obtain timely diagnosis, correct? treatments and to avoid complications. The recommendation is to have these tests at least once a year, or whenever you change partners and wish to be sexually active, to ensure that before starting a relationship, both are confident everything is okay, and if an infection is found, treatment can start. Now let's move on to the next question, which I'm sure many came to see in this video. What is the treatment for genital herpes? While there is no cure for genital herpes, there are several medications available that help relieve symptoms and decrease both the intensity and frequency of outbreaks. These medications are oral antivirals such as acyclovir, valacyclovir, and famciclovir, which lessen the severity and duration of episodes. These medications must be prescribed by your doctor, and you should take them under their supervision, as the dosage and duration will be determined by the intensity of the symptoms and the severity of the outbreaks, and the doctor needs to assess your specific case. These medications help lesions heal faster, reduce the severity of symptoms, and shorten their duration, and they also help decrease the chance of transmission to a partner. For recurrent genital herpes, the doctor may suggest suppressive therapy, which helps prevent outbreaks and decrease the number of outbreaks per year, and it also helps lower the severity and duration of symptoms while reducing the risk of passing genital herpes to a partner. It is important to learn to identify the prodromal symptoms, which appear before lesions develop, such as the burning sensation, pain, tingling, or itching in the genital area, as starting treatment during this phase can lead to better results and greater effectiveness, even preventing lesions from appearing, so you can continue living your life normally. Because it is a disease that cannot be cured since it can appear periodically, if you identify the prodromal symptoms and start treatment in a timely manner during this stage with your doctor's guidance, you can have a completely normal life without complications. Is there anything that can be done to prevent genital herpes? Well, something like preventing genital herpes, the reality is that you can't. The only way to avoid sexually transmitted infections is to abstain from sexual activity. But to be honest, most people will engage in sexual relations at some point in their lives, but what we can do is follow certain measures and recommendations to reduce the risk of contracting an STI, such as the following. Number 1, as I have mentioned in other videos, use a condom for every sexual encounter, since condoms, whether male or female, are the only methods that help reduce the risk of contracting a sexually transmitted infection, as they create a barrier between skin and fluids. But be aware that this method isn't 100% effective, since there may be other areas of skin that the condom does not protect, where there could be a risk of transmission. But it is always better to use it than not to use it, because while it doesn't provide 100% effectiveness, it does greatly lower the risk. Number 2, if you or your partner have visible sores, avoid sexual relations during these days, or sharing contaminated items with the fluid from the blisters, since this boosts the risk of transmission. It is also important to avoid sexual relations during the prodromal period, when you start to notice the symptoms I mentioned earlier, which appear before lesions develop. And as I mentioned earlier, even when there are no symptoms present, there is still a risk, which is why it's always important to use a condom. Moreover, if you have cold sores, remember that these can also spread to the genital area, so avoid oral sex. Before wrapping up this video, as I know this topic generates many questions, I would love for you to leave any doubts you have about this topic in the comments, because I will make a second part responding to the most common and interesting questions you have about genital herpes.